Stimulation of the sympathetic nervous system produce which one of the following response? Bradycardia, tachycardia, hypotension, decreased myocardial contractility. G. In 41, the correct option is option B, tachycardia. Move to MCQs number 42. A classic sign of cardiogenic shock is bradycardia, low blood pressure, hyperactive bowel sounds, increased urinary output. Cardiogenic shock is low blood pressure. Option B is the correct options. A person suffering from carbon monoxide poisonings present with severe hypertension appear intoxicated, appear hyperactive, will always present with cherry red skins coloring. Which one of the following is correct in 43? जी, कार्बन मोनोऑक्साइड पॉइजनिंग हो तो क्या उसकी सफरिंग होगा? ऑप्शन बी इज द करेक्ट. 44. Which of the following is the presentation of hypovolemic shock? Which of the following is presentation of hypovolemic shock? Pulmonary edema, hypotension, jugular vein distensions, and flat neck veins. G. Flat neck veins. 45. Which of the following drug is indicated in cardiogenic shock? Dopamine, dobutamines, norepinephrine, and phenylphrine. Option B is the correct. Dobutamines is the correct options. Which of the following drug is indicated to improve renal perfusions? Dopamine, dobutamine, norepinephrine, and phenylphrine. As I told you that we can give whenever we can give dopamine and low dose, it's renal dose and cardiogenic dose. Low dose is for renal perfusion and high dose is for cardiogenic perfusion. So option A is the correct options. Systemic approach to manage emergent or urgent situations, paramedic survey indicate assessing A, B, C, D for the patients, which means airway, breathing, circulation, dignity, airway, breathing, circulation, diagnosis, airway, breathing, circulation, disability, airway, breathing, circulation, defense. Option C is the correct option. Disability is the correct options. 48. A 25-year-old male working as a farmer has been bitten by a snake that has caused severe irritations, pains at the site, and respiratory distress. Generally, what can be the possible diagnosis? Poisoning, skin allergies, anaphylactic reactions, and local inflammation reactions. Severe irritations means the patient is an anaphylactic reactions. Option C is the correct options. A substance cause poisoning can cause poisoning through which of the following routes? Inhale, absorb, produce within the bodies. All of the above. जी, all of the above is the correct options. Absorb भी हो सकता है, inhale भी हो सकते हैं, produce within the body भी हो सकते हैं. Which of the following condition is coded as red in medical triage management? Vomiting, fresh blood, high grade fever, close fracture, and persistent vomitings. Option A is correct because it's vomiting during fresh blood. Therefore, it's most emergency. Option A is correct. 51. Which of the following condition is coded as a yellow in medical triage management? Vomiting, fresh bloods, high grade fever, close fracture, and persistent vomitings. Option D is the correct for yellow, persistent vomitings. A patient age 40 has been received at emergency department who has multi penetrating head trauma. The patient is hypoxic and gasping and about to die. What color code will you give at the patients? And 52 is black. डाई के लिए हम black यूज़ करते हैं. 53. Another female patient has just arrived at emergency who is 50-year-old and has got acute chest pain radiating towards left arms with vital sign is 160 by 100, rate 105 and respiratory rate is 20. What coded code will be you give to the patients? अब पेशेंट्स की ये कंडीशन है तो कौन सा कोड हम देंगे? ऑप्शन ए इज़ करेक्ट रेट. Medical triage management should be based on the technique STARTS, which does this means term means to start triage and rapid treatment, simple triage and rapid treatment, simple triage and rapid treatment, none of the above. Option C is the correct, simple triage and rapid treatment. Now put ABG's questions. The nurse is assessing a patient with acute respiratory distress. The patient is on the ventilator with positive and expiratory pressures and receiving oxygen via endotracheal tubes. The nurse evaluates the client's blood gas ABGs and PaO2 50 ml of Hg, PaCO2 35 ml of Hg, SCO3 is 24 MEq per liter, pH 7.40. Which of the following indication the patient is not receiving sufficient oxygen? जी PaO2 जो 50 ml of Hg इसलिए कम है आपके पास, तो आपके पास ऑप्शन ए इज़ करेक्ट. 56. Intra-aortic balloon pump is a mechanical device that is used for increase myocardial oxygen demands, decrease cardiac output, increase myocardial oxygen supply, decrease myocardial oxygen supply. Option C is the correct, increase myocardial oxygen supply. अच्छा 57. Intra-aortic balloon pump consists of a cylindrical balloon that sits in the aortic and counter pulsation. The mechanism of work include as it equally deflate in systole, reducing forward blood flow by reducing afterload. It actively inflate and deflate during systole to increase the preload. Actively inflate and diastole, increasing the blood flow to the coronary artery. Actively inflate and diastole, depleting blood flow to the coronary artery. Which one of the following is correct? Option C is correct. Hemodynamic monitoring consists of non-invasive, invasive, both, none of the above. Both.